How will ACOs, now responsible for assuring all participants report promoting interoperability, that is PI, be impacted by the actual performance of all participating TINs?
Great question, Lisa. 2025 is the year that the rule goes into effect that all ACO participants are expected to use certified EHR technology, that's CEHRT or CERT, and to make a promoting interoperability submission. In prior years, 75% of the advanced APM participants and 50% of MIPS APM participants were required to use CERT. Now, there are a couple of caveats into this new requirement. There's a big loophole in the requirement. All of the exceptions that exist for the MIPS promoting interoperability performance category apply to the CERT use requirement in ACOs, including small practices, facility-based practices, and non-patient facing practices. So if they don't need in MIPS to submit promoting interoperability, they don't need in ACOs to be using CERT. Now, the use of CERT is a contractual requirement built now into all ACO contracts with CMS. There's not a scoring requirement, just a submission requirement. Neither the individual scores nor the composite ACO score factors into ACO performance or collection of shared savings. So no scoring effect on the ACO. Now there are some indirect effects, so beware. A couple of my clients have gotten trapped by this. There's one other factor to keep in mind about scoring. Though the ACO will not experience any differential payment based on the promoting interoperability score, that is not true of the participating TIN practices or the participating NPI providers. That's TIN is tax ID number practices. That's how Medicare identifies individual practices, and or NPI providers. Again, that's how Medicare recognizes individual providers. Those practices and providers that are MIPS liable will have a MIPS adjustment to which the promoting interoperability score is important. Even though promoting interoperability score will not affect ACO collection of shared savings, it will affect the MIPS adjustment of Medicare payments to practices and providers. Now, the ACO might be collecting that for all of their practices and providers, so it may affect ACO payments. But again, it's not a direct effect on the ACOs; it's an effect on the practices and providers. In a MIPS APM, every practice and provider in a MIPS APM will have a MIPS adjustment. In an advanced APM, every provider in an advanced APM that doesn't achieve qualified participant status will have payments affected by the MIPS adjustment to which the PI score applies. So I hope that answers your question, Lisa. Be careful. The same performance category and submission count for both, but they're treated differently on the MIPS liable providers in your organization and the ACO itself.